Dr. Hussain, you probably regularly have patients coming to you saying, I have this ringing in my ear. Is that tinnitus?
Yes, ringing in the ear comes from the Latin word and it's pronounced tinnitus, and that tinnitus can be persistent or it can be intermittent. It can present in one ear or in both ears. When it usually presents as something troublesome is when it becomes persistent and heard even when they're trying to go to sleep at night.
Mm-hmm. And the causes, what causes tinnitus?
So causes are multiple, and it could be anything from medical infection to the ear, on one ear or both, trauma, injury, and commonly noise exposure.
Mm-hmm. Anything more sinister than that? Do we think tinnitus or something horrid is happening?
So a lot of people do think that when they have tinnitus with balance problems that there could be something growing inside their head. And it's very important to get the advice and get a hearing test to see if there's an asymmetry or a difference from one ear to the other as a first port of call.
Mm-hmm. And so how do you diagnose, and you'd say, yes, this is tinnitus and the cause might be this or that?
Right, so first of all it's important to get a history from them, find out the probable cause, and it's usually you can trail it back to some injury or medical reason, and from there then you will do the hearing test, examine them with a light and check their middle ear, and with the hearing test you can identify the frequency, so it's the pitch and intensity of the tinnitus and the sensation level to see how much more louder it is than the hearing threshold.
Mm-hmm. And are there things that make it worse?
So there's many things that make tinnitus worse. Commonly, lack of sleep, stress, anxiety, smoking, caffeine. I can name many more. I mean, a vegetarian diet with lack of B12 absorption, additives such as monosodium glutamate when you go out for a nice Chinese restaurant meal, and caffeine.
Caffeine, yes, the usual culprits.
Usual culprits,
what then tends to make it better?
So if you can modulate the aggravating factors that you know cause an aggravation to it, that's part and parcel of trying to sort out the treatment. However, if there's a specific hearing loss and you've identified the frequency and intensity, you can actually amplify in that area with a correct hearing aid prescription and obviously mask out the internal sound.
Mm-hmm. So you can help patients live with it, or at least manage their tinnitus so that it becomes more bearable?
Yeah, sure. I mean, the biggest thing is to identify whether it's sensory in its origin or neural in its origin. Obviously sensory is with the hearing aid amplification. Neural is obviously looking at the neural health in the nerve and its perception of the sound. Together a combined approach certainly helps with reducing the effect.
All right. And does it usually start as a very abruptly, or is it something that just creeps up and then really bothers you?
Yeah, so I mean both. I have patients who come through with acute noise trauma after going to a loud concert. Or exactly, or a loud pub and spending the whole night without sleep. They're tired, and of course they come back the next morning with a bit of tinnitus, and they're worried because they haven't perceived it. So it can be acute as that, or it can be as a result or secondary to some chronic inflammation which is developing within the body or around the ear itself.
Mm-hmm. Yeah. And does it sometimes just disappear spontaneously?
Yeah, well, about a tenth of the population has intermittent tinnitus, but a further tenth has troublesome tinnitus. So if you think about it, we all get it occasionally in our life when we're tired or fatigued or stressed or sitting our final exams. However, it can creep up, but if you're not keeping yourself healthy and well with a balanced lifestyle, it can become permanent.
That sounds very difficult. and the age range, when is it most frequent?
Well, the age, in my opinion, this is an interesting question. I believe we're born with it, because when you're born, it's quite traumatic, and so I can imagine it's only because babies at that age cannot tell you that they have tinnitus, and any traumatic time in your life would result with a systemic presentation of that physiological noise, which is tinnitus.
And if it's chronic, does it necessarily get worse and worse and worse, or does it stop?
The important thing is to seek appropriate advice as early as possible and get the right treatment advice as early as possible, because if it's undiagnosed or untreated, like any pathology, it will get worse and worse, because your perception is something that's worrying you more so, and that stress, the neural stress, for instance, as I talked about when I explained to patients, the basal membrane, which is an elastic band-like membrane, when sound comes in, when it's tight, sound comes in, it vibrates and amplifies so much more than when you're relaxed, and so it dissipates so much more quicker. Yeah.
So in other words, there are things that can be done to help patients live better and more comfortably with tinnitus,
Sure.
even if it doesn't completely go away.
Well, yes, in short.
Thank you very much, Dr. Hussain.
Thank you.